Yep.
The 3 days before Thanksgiving?
Yep. We're closed Thanksgiving Day, but we're open all the other days.
Are you going to be working or taking some time off?
I'll be there from 7 till 4 through Wednesday, and actually doing surgery on Friday.
Wow, great.
So.
Well, welcome everybody to our latest Ask Portland Clinic social media chat. I'm your moderator, Gary Rubin, and today our special guest is Dr. Robert Sandmeier from the Portland Clinic, who's an orthopedic surgeon, and we're going to be talking about how to stay active this winter and also how to stay healthy this winter when you're out doing those outdoor activities. If you have a question that you'd like to submit today, you can use the comment section on Facebook or on Twitter. You use the hashtag AskPortlandClinic, and we'll get to as many questions as we can. So, Dr. Sandmeier, let's get started. First,
Okay.
Give me a little bit of a definition. What is orthopedics, and what does it mean to be an orthopedic surgeon? What do you do?
So orthopedics is working on the musculoskeletal system, so the bones, the joints, muscles, tendons, ligaments, and also the way they sort of work in a coordinated fashion together. And there are many branches of it, so there are orthopedic surgeons who specialize in pediatrics or spine or trauma, where they really do all the fractures, joint replacement, and sports medicine, which is what I do. And that's mostly, in the end, it ends up being mostly knee injuries and shoulder injuries.
Right. So tell me a little bit about the first visit. If someone has never been to an orthopedic surgeon before and they have a need and they come and make an appointment with you, what should they expect from a first session?
Okay, so the first thing is they'll come in, and before they even have their appointment, we'll usually get an x-ray of the body part that's bothering them. And that's because we're the guys who are not supposed to miss the unexpected thing, like a cyst in the bone or something like that. And also, most of the time people come in because something hurts, they've often fallen down, and there's a question if there could be a fracture. And we want to know that from the beginning so that when they come in the office, I don't, grab their knee and start wiggling it around to check it, and then it turns out they had a fracture the whole time.
Right. Okay. So if I need a referral to come see you, or is it easier just to make an appointment directly with your office?
So it totally depends on your insurance. Most of the time, if you called to make an appointment, the office would be able to tell if you needed a referral or not from your insurance. They could tell you.
Okay.
I would say the most efficient way to do it would be to just call directly to come and see the orthopedic surgeon. If your insurance lets you do that, it really kind of saves a step.
Right.
And more of them are letting you come directly.
You sort of know if you need to go to a certain type of doctor. I would think that you kind of feel what you need. Is that right?
I think most people really kind of do,
Yeah.
what's going on. And primary care doctors, who are the person you usually start to see, they certainly know a lot about a lot of the musculoskeletal things. But so much of the time they're going to send you to see us anyway that
Right.
it's worth saving the step if you can.
Okay. So tell me a little about the most common ailments that you see, and this is a real important section, so we can spend a couple minutes on this, but what are the most common type of injuries or ailments that someone has when they walk in the door to see you?
So since I do sports medicine, most of my things are going to be related to sports kind of things. And it depends somewhat on your age and what you're doing, what are the things you're going to have. So for kids in school age, it's usually a fall and a contusion, a sprain, strain, maybe a fracture. Most of the time, though, when you're smaller, you sort of don't tend to get hurt. You kind of have things happen, but it's almost always something that just is going to get better with a little time and a little help.
Right.
Then once you hit sort of 13, 14, your sort of things are happening where you're big enough and fast enough and strong enough that now you can kind of hurt yourself a little bit more.
Right.
And that's when you start to see ACL tears, for example, for the knee, that sort of thing. And then that kind of goes up until you start to hit later high school, maybe hitting into college age. That's when you start to see, again, more ACL tears, fractures of collarbones, for example, broken wrists, that kind of thing. Then after that, there's usually kind of a lull where people are not doing those heavier duty sports once they're out of college. They're kind of doing more fitness things. They usually do pretty well for a long time. Then you start to hit your sort of later 30s and 40s, and you kind of get these things that are largely happening because you're trying to do things you used to be able to do, and you don't realize that parts of your body are kind of not in that same shape anymore. And it doesn't necessarily mean they can't get there,
Right.
but you're sort of trying to do things you're not quite up for. And then after that, you sort of get more of the degenerative things like cuff tears and stuff in your 50s and 60s and arthritis.
So after a diagnosis, what kind of treatment options or treatment plans do you put patients through, and how do you supervise those?
Okay, so it definitely depends on what you've got. So first point is that although I am an orthopedic surgeon, we probably only do surgery on maybe 10% of the people who come in. Most people have things that don't need surgery. By far the most common thing is we have them either work with a physical therapist or a trainer, or maybe just on their own to modify their exercise program to try and fill in gaps. So the way I think about it, a real fitness program has kind of three main parts. It has aerobics, flexibility, and strength. Most people only really do one of those with the sport that they're doing, and they need to do some of the others to just kind of keep things balanced out and be less likely to get a lot of these injuries.
So our topic today is about winter, and winter sports are coming, and the snow is coming, and the holidays are coming. That means a lot of outdoor snow-related activities. What do you see most during the winter months in terms of injuries, and how do people recognize that they maybe have a need to go see an orthopedic surgeon?
Well, the most common ones are you fall down and something happens and it's pretty clear the part hurts, it's sore. So again, depends on what you're doing. So I would say for snowboarders, and probably for most people who get hurt when they slip and fall, you put out your hand, and a broken wrist is going to be the most common thing you're going to see. And that one's pretty obvious. You know, your wrist hurts, might not look normal. You get an x-ray, you'd come in and see somebody. For the knee, it's kind of there's sort of two things that happen. The most common one is actually often a low speed thing where you're going along. I see this a lot with people who are trying to teach their kids how to ski. They're going along and their ski kind of starts to turn out and they're slowly going along, you know, not quite fast enough to get a hold of it. And then their knee ends up kind of getting bent sideways and they strain their MCL, which is the ligament on the inside half of your knee. That's not really a surgical thing usually. But that's a pretty common one and a pretty common scenario when you're actually going really slow. Then the other one is tearing your ACL, of course. That one usually going faster, and that really changed once we got ski boots that were really rigid. Before that, you would hurt your ankle or maybe even have a fracture at the top of your ankle. But now, if you wanted to hurt your knee, you know, you'd think about it, you'd get a big brace on your foot, and then you'd put a big long lever on the bottom of it so you could get lots of force going. And then you'd go at speed. So that's kind of what skiing is. So that's why people tear their ligaments when they ski, especially the ACL being the most common one that way.
The knee, as we were talking about this earlier, the knee is probably the most vulnerable spot on the body. Would that be accurate?
It's certainly the part that we probably do surgery on the most of the joints when people come in.
Okay. And tell me about a recovery period. There's probably, unfortunately, going to be some folks out there who are going to be ACL surgery candidates, I'm sure, this winter. What can they expect going forward? What's a typical recovery period, or until they're back on the slopes or back on doing other activities?
Okay. Well, for an ACL, that's a pretty long one because the surgery itself takes about an hour. Go home the same day. We give you crutches and a brace. Most people use them for about 2 weeks. And it's okay to put your weight on the ground and that sort of thing, but you just don't have that good control of your leg for a little while. Usually by 3 weeks, day-to-day walking around is pretty good. And then it's a progressive exercise program, and you're working with a physical therapist starting from the first week. So hopefully you're hitting the exercise bike by maybe a month. Lunges, say 2 months, something like that. Running is usually about 4 months before you just are feeling like you can do it. It's not so much you're waiting for me to say you can do it. Right. It takes about 6 months for your new ACL, because we rebuild it, to really grow in and be alive and as strong as it's probably going to get. So if you wait longer than that, the ACL is probably not better. If you go in sooner, it's probably not as good as it would have been. So 6 months is kind of our target. But realistically, at 6 months, you're just not as good as you were. It usually takes a year before you're kind of back where you're really feeling fit. Right. And one of the big parts about injury is that in order to keep from getting injured, you should be pretty good at what you're doing. So, you know, that means that you know how to do it. You know, you're coordinated, have sort of the skill set, but also that your body's strong enough, has enough endurance and that sort of thing to be able to absorb those forces. And that just takes a little longer than that for the ACL. For other things, it's a lot shorter. And people often ask me, how long, you know, what's the recovery time? And That's actually a pretty hard question because there's two big parts. One is how long before I say you can do it. Like if you broke your leg and I say, well, you shouldn't put weight on it until we get an x-ray that shows that it's healed. And that might be 6 weeks is kind of a standard time for that. Mm-hmm. But your real question is how long before you feel like you can do it and it's comfortable and you're feeling pretty good about it. And that one is really variable. And frankly, it also depends a lot on what are you willing to put up with.
Right.
Some people really want to push it super hard and others are more cautious. So there's a lot of variability for that second piece.
Okay. So during the winter, and we're fortunate here in Portland that we're not under snow all the time. So year-round activities like walking and running and hiking still take place during the winter months. What do you see in terms of those type of injuries during the fall and winter and up into spring? Still very common during that time of the year?
Well, for them, I guess again, two parts. So there's the slip and fall kind of things, which can happen with any of those activities, and maybe more when you're slipping on the wet leaves and that, or right. Slipping in the mud. The other ones, especially with the runners, what I'd call the overuse injuries. And in a way, I don't really like the term very much because it's usually not that you're trying to do something crazy, like you're running 20 miles a day, 5 days a week. Usually it's more just that it's getting overused because the body's not absorbing those forces well. It's not spreading them out. And the way I kind of look at it is if you were perfectly balanced and you were running, you could run soft, where your feet aren't pounding the ground. And by the time you're done, your muscles are exhausted, but nothing really had a lot of stress on it. And then a day or two later, your muscles are back and now you can go again. Now, none of us are perfect. Some are obviously closer than others. Right. But the big things that the runners miss out on is that running's just such an appealing activity. You just go out the door, all you need are your shoes. Nobody right. bothers you because they can't find you. But you really need to have some of the strength and flexibility things that keep those other parts of your body able to absorb those forces. Mm-hmm. Otherwise, that's when you get those kind of overuse things.
So if someone starts to feel like they maybe are getting to that point of overuse, what should they do? Take a day off, take 2 days off, let the body recover a little bit?
Well, I guess the big thing I think that would be the best plan would actually be not to have a program where you're just doing the same thing all the time. So first off, I mentioned the 3 parts of fitness, the aerobic fitness, the strength, and the flexibility. Mm-hmm. But even if you're just talking about the aerobic part, you wouldn't think you had a balanced diet because you ate 3 kinds of pasta. Right. So if you're looking for aerobic activity, there should probably be some running, maybe some cycling, maybe some swimming. Just kind of mixing it up increases your durability because your body is good at doing more things, and because you're not using the same parts the same way every time. Right. It sort of spreads it out.
Right. So we're still in football season technically, mm-hmm. And here in Oregon we're getting into the playoffs. If parents might see their kids are in need of something orthopedic-wise, what do you suggest in terms of recovery or making an appointment? Or what should they do if they suspect that their kid might need someone to look at them?
Well, obviously call and make an appointment.
Yeah.
Although I will say in all of the Oregon high schools, at least in the Portland area, they all have an athletic trainer. So that's their first line of defense. So, for example, I'm the team doctor for Sunset High School, and we have an athletic trainer there. Yeah. She's there every day and works with the kids and knows what's going on and knows about their, bumps and bruises and things people aren't too worried about, mm-hmm. but, kind of keeps an eye on it, and then would send them to see somebody like me, or I might see them in the training room to help figure out what to do. Okay. Usually the big things are, one question that is very important for the kids is, can I play? Can I play this next weekend or not? For the parents, it's more what's wrong and should we let him not play because we don't want him to get hurt and have something that's going to be damaging in the future. So in the end, you got to come in for us to check it out. And I do think that's when it really helps to see somebody who does sports medicine because, for example, if you go to the emergency room and they see that you have, say, a fracture of your wrist that, not one that needs surgery or anything, they'll put you in a splint and they'll say, don't do stuff for a while until you get in to see an orthopedic surgeon. That might be a week or whatever, and you're kind of losing that time. If you came and saw somebody like me, we would look at it, and kids play in casts all the time. So we would know what kind of fractures can you play in, How do you put a cast on it that you can wrap and pad so it's okay to play within the rules? When is it reasonable to go back? Even though you're injured, you aren't necessarily out. Sometimes you are, but at least you'd kind of have your options, and you'd know, is this something where maybe I can be playing before the season's over?
Yeah. Speaking of children, what other kind of specific injuries that you see during the year? Maybe not so much in the winter, but maybe spring and summer when kids are outside more. What kind of goes on there in terms of the injury side that you see?
Well, the big thing is it goes down by a lot. So football is a sport that causes a lot of injuries. I mean, it's one of the only ones where everybody runs into everybody every play. Most of the other ones, it's a lot more accidental kind of things. So in soccer, for example, we have a lot of the same injuries. People tear their ACL or the MCL. Maybe they get a concussion from two people going up to head the ball at the same time and their heads hit each other. But the frequency is much less.
Right.
Then other sports, a lot of those are more overuse things. So swimmers, for example, really tend to have a lot of shoulder pains and things like that. Almost never any sort of surgical thing, but they just need to do some rehab kind of things to kind of get back to that idea of your body. You may have one skill you really want to work on, but at the same time, your body has to have a certain balance to be able to handle the stresses you're putting on it.
Right. If you're just joining us, we're here with Dr. Robert Sandmeier, an orthopedic surgeon from the Portland Clinic, and we're talking about staying healthy this winter and doing some preventative work as well to keep yourself healthy when you're out there on the slopes or doing other outdoor activities. So let's get into the treatment a little bit more, and we touched about this earlier, but when you're treating an injury, what can you do to maybe help yourself recover faster, or are there things or tips that you can give us that can help people who are out there who are recovering?
Sure. So in terms of just a non-specific injury, maybe I'll pick something like an ankle sprain. Most everyone has had one of those in the past. It's generally not something you're worried about needing a surgery on, but you'd like it to be better as quickly as possible. So there's different phases of what happens. The first phase is when you have swelling and pain and inflammation. Some of that's needed to set the stage for healing. So when you have an injury, your body releases these different factors that set the stage for cells to come in and repair the damage. So you don't want to, and probably can't, completely stop the inflammation part, but you can slow it down a little bit, maybe by icing and elevating, so just so the swelling part isn't so big. The main time where I think that's the big thing to concentrate on without working on a lot of the rest is probably the first couple days. After that, that part's still kind of tailing out a little bit, but now you want to start getting some range of motion back so that you aren't stiff longer than you need to. Then once you have your range of motion back, then you start to want to add some strengthening things. You can't really strengthen until you have some range of motion to move in to do the strengthening exercises. Then after that, you want to start getting back into actually using it. So for the ankle, that would be things, where you're walking and then progressing towards running, straight ahead, and then sideways things and real balance training kind of stuff. And in the end, for all of these injuries, you have to go through those different steps. You don't necessarily have to wait for one to be done before you do the next. And a therapist or somebody can help you to have that happen as quickly as possible. But you do have to work your way through those things.
Okay. How about some tips for overall wellness of an athlete or a recreational jogger or skier? Are there some things that we can do for nutrition or sleep or help us prepare for these activities that we're doing? What are some recommendations that you have?
Well, one of my favorite sayings is that usually you're supposed to do the things you already know you're supposed to do anyway. And I think that's totally the case here. So a lot of people don't get very good sleep. And they go to bed late, they're watching TV, they're maybe even still looking at their phone in bed, that sort of stuff. So getting a good period of time where your body has a chance to repair itself is definitely a key thing. The nutrition thing, kind of the same thing. A varied diet is the key. There are all sorts of, I guess I'll call them fad diets and things, but even having, say, just eating broccoli is really just a different kind of malnutrition than just eating French fries at McDonald's. Your body needs all these different things to work well. And it may not need as many of some of them as we usually eat. You could use more broccoli and probably less French fries from McDonald's. But still, you do need some of the different things for your body to be balanced. And the same thing is very true for the exercise side of it.
Yeah.
Is that you need to have some good aerobic things, and your cardiovascular system doesn't care what you do. So you can be very cardiovascularly fit for running by swimming today, or by doing something else that gets your heart rate up. There's a lot of evidence for that the best way to really increase your cardiovascular fitness isn't the sort of steady pace for a while, but really to have it vary. So like maybe you have a day where you're running some hills, or where you're sprinting and then slowing it down for a while, where the heart rate's kind of going up and then kind of down to medium and then up and then maybe low and then up again. So lots of variability helps with and you get more out of a 20-minute workout like that than an hour of steady pace.
Okay.
Then the next part is going to be like the strength training part. And that's one where, you don't have to end up trying to look like Arnold Schwarzenegger, but doing real strengthening things help. And if you do see a lot of people who really like aerobic stuff, and they're trying to do some of it, and they pick really little weights, and they're doing like 50 reps, that's still kind of endurance again.
Right.
So some of it should be real strength stuff.
Okay.
And then the last big one is the flexibility piece. And I see so many runners and people like that who say they stretch every time before they go. And you see them, at the end of the trail there at Forest Park, and they're like trying to touch their toes before they run. Maybe try 10 times, can't do it any of the times.
Right.
Then go off on their run. They've been doing the same thing for 10 years, haven't been able to touch their toes any of the times.
Right.
They're not getting any better at it. They wouldn't look at their running program and think they were running if they weren't getting any better at it.
Right.
It's the same thing. If you're really trying to do a flexibility thing, you should be getting better at it. If you're trying to do a strength thing, you should be getting stronger. You shouldn't be at the same place all the time.
Right. Touching back on nutrition that you mentioned earlier, are there certain foods or food groups that are good for the bones and help build up resistance to maybe some injuries? What can you talk about there?
Well, for bones, I don't think we think about it in terms of food so much as as calcium and vitamin D and that sort of thing.
Right.
And there was a big push for a while where people were talking about having more calcium. And it turns out there were some other problems that seemed to come up with that, like heart disease issues and stuff. So now the big thing is vitamin D. And especially here in Portland, because most of us don't get much sun, which is how we normally get our vitamin D, because it's not sunny most of the time. And in fact, when it is sunny, most of us are putting on sunscreen, so we don't get vitamin D then either. So taking vitamin D is probably the biggest thing that way. Then the other part in terms of the bones gets back to the exercise thing. And weight-bearing exercise and impact exercise are the biggest things that help with that. So for that, that's something you get from running, for example, you don't get with swimming.
Right.
But having some of that helps to maintain your bone density.
Okay. So as we close out our chat here, give me your top tips again for maybe those who have just joined us late of overall wellness for the body, and particularly as you start looking at outdoor activities like skiing and running this winter. What should we be thinking about, and what can we do to help ourselves?
Well, I guess the first thing I would say is we should be realistic. Because we were good at something 10 years ago, we may still have the skills to go out there. We still may still know how to go out and ski and carve that turn, but that doesn't mean our body has the stamina, the strength, the flexibility, that sort of stuff to be able to do it like we did before. That's a pretty common cause of injuries. And then the other big one is the example I used about a good diet being varied, and that it's the same thing for exercise. You may have favorite exercises you like, but you should really mix it up and have your body get challenged in different ways. That's how you improve your fitness, and I really think that helps to decrease the likelihood of injuries as well.
Okay, excellent. Well, that's all the time we have for today's chat, and thank you for joining us. And if you do have questions, leave a comment down below on Facebook or on Twitter. Use the hashtag AskPortlandClinic. You can also call the Portland Clinic if you're interested in talking with Dr. Sandmeier or making an appointment. Again, thanks for joining us, and we'll see you next time.